A very good morning to you, dear students, to your English class. Today we will learn a science-based lesson, that is Chapter 4.2 Revolutionary Steps in Surgery Part 1. In the background picture you see, you will notice doctors who are basically surgeons. They are operating with medical scissors, medical equipment in the operation theatre. And here you can see the entire operation theatre, where you see the operation bed, then you see the medical scissors over here, then you see the monitors. These are vital monitors to check the heartbeat, and then there is a monitor here to see the brain functioning, the left and right side of lobes of the brain. These are the lights, focus lights, and here you can see the solutions which they use during operation. And these are all the machinery equipments, medical equipments which is being used during the operation time. In this lesson you will learn a lot of interesting facts about the medical field, about surgery and advances in science medical field. So let's go ahead. Firstly, let's do a surgery activity called match the columns. In this, imagine that one of your family members or friends or classmate has recently undergone a surgery. You are curious and want to learn about his horror experience in the operation theatre. So you have to match the questions with their answers. This is you asking your relative, that means the patient. Whoever is your patient, these are the questions, and what is your relative's response? You have to match it. For example, I give you one example. What health problem did you suffer from? Then look through all the options. Then we match it with this. I had fractured my ankle while playing hockey. So this is your relative response. This is you asking, and this is what your relative will respond to. Okay, so match it correctly. Now we'll go to the next. I want to do all this. Next we come to types of surgeries. There are 4 types of surgeries we will see in this lesson. First one is plastic surgery. Here you can see the picture of this man being operated on his face. What is plastic surgery? Do you know, children? Plastic surgery is where doctors operate on the face to make the face look even more better. They operate on the nose, cheeks, jawline, chin, forehead, ear, all these places they operate. Mostly and mainly many actresses, rich people do it to change the texture of the face, to make them look fair or something, however they want them to look. Secondly, we go to cardiac surgery. That is basically where doctors operate on the heart valves. When there is blockage in the heart, they operate on the heart. So to remove the blockages. Third, we go to neurosurgery. What is neurosurgery? It is related to brain. Here you can see the picture of the brain, where the doctors operate on the brain to clear the blood clots in the brain. In the brain, sometimes the blood gets clotted, so there is no blood flowing to the brain properly, and it gets stuck over there. So they have to clear the blockages so that the brain will function correctly. And lastly, we come to robotic surgery. Robotic surgery, which is the latest form of surgery, is done by robots. Here you can see in the picture, robots are operating on the person, but it is controlled by an expert team of doctors. The doctors are here and they are controlling the robot. So you will see all this in this lesson. You will read and listen. Okay, so let's go ahead. Now in the explanation part 1, we will be doing page number 82 of your textbook. Explanation part 1, page number 82. Please listen, read and repeat the words that are said in the video. There are many medical terms So you'll have to listen very attentively, and you will also learn the meanings of them in this part.
Be teaching you all this unit 4.2 of our English textbook topic, and the topic of our prose is revolutionary steps in surgery. Now you all must be thinking, what is the meaning of revolutionary? Revolutionary means something, a change, okay, a total dramatic change or sudden change that has taken place. It can be all around our world. The meaning of revolutionary is a dramatic change. So today we are going to study a dramatic change that has taken place in surgery. Everyone, please open your English textbook to page number 82. Revolutionary steps in surgery. The meaning of surgery is, in short, is operation. Okay, and as I have mentioned earlier, the meaning of revolutionary means dramatic change. Okay, so today's lesson is all about surgery and how over the period of time this surgery has taken up its advanced changes in the fields of science. So earlier, as we know that we did not have advanced technologies, and therefore we were lacking behind in regards of this advancement. But after 19th century, we see that there is this change that has taken place, which has led to advancement of technologies, phones, communications, education, and so on. So one of the advancements that we are going to study today is surgery. Surgery dates back to as early as 600 BC. So in India, this surgery date started as early as 600 BC. Sushruta Samhita is one of the oldest works in the world dealing with surgery. So a girl named Sushruta Samhita, she is one of the oldest known person who is dealing with surgery. It indicates that Sushruta was probably the first surgeon to perform surgical operations, that is plastic surgery. Later, some ancient surgeons performed tooth extraction and bloodletting. So in the early as 600 BC, there was one girl named Sushruta Samhita. She was dealing with this surgery, and she was probably the first surgeon to perform a surgical operation of plastic surgery. And then later on we see that there are many other people coming from ancient surgeons who performed tooth extraction. Tooth extraction means you all can see, if there is a problem in your tooth, they extract it, they remove it out. And bloodletting. Bloodletting means draining out blood. Okay. Major surgery could not develop for centuries because of lack of knowledge and technology. As I mentioned earlier that we did not have so much development because of lack of knowledge, lack of technology. The doctors had to cut open the part of the body that was not healthy, remove it or set right that part. So During those times, that doctor had to cut the open part wherever that infection or wherever that part is not healthy. They used to remove it or set some right that part. They used to check which part is not healthy and accordingly they used to replace. This would involve a lot of pain to the patients. As I mentioned earlier, during the earlier times, we did not have those many advanced technologies that we have today. And therefore, during the past times, we see that when doctor used to cut some part of injury or some part of body which was unhealthy, the patient whose part they used to cut, they used to suffer a lot of pain. Okay, this involved a lot of pain to the patients. General anesthesia like ether or chloroform developed only from mid-19th century, making painless surgical operations possible and successful. So you all heard about this anesthetic or chloroform, which is very helpful for the patient when patient is doing some surgery. Mostly the doctors inject this patient with anesthesia so that they cannot feel the pain while operating, while doctors operate. The meaning of anesthesis means it is a substance that makes one feel no pain. So once they inject that, the patient who is lying on that bed for operation, he or she does not feel that pain because of this anesthetics, because it is a substance which it's like a drug-like substance, okay, and once that is injected, the patient no more feel the pain. Modern techniques are used nowadays for anesthesia. General anesthesia pinups the whole body and it is used for surgery of any region of the body. Pinups means it makes the body numb so that the patient who is lying on the bed does not feel that pain. So nowadays we see that in modern technology most of the doctors use this anesthesia so that the patient lying on the bed does not feel the pain anymore while operating, and it can be injected in any part of the body where that operation is taking place so that that particular part stays numb. Okay. General anesthesia pinups the whole body and it is used for surgery for any region of the body. For local anesthesia are injected into the surgical spot or any area near nerves. So wherever that operation is taking place, over there a particular nerves, they inject that anesthesia in that particular area or particular surgical spot so that that particular person doesn't feel the pain. For example, if you all have any teeth problem, or if you all are doing root canal, so you all see that the dentist inject anesthesia so that you all don't feel the pain while doing that teeth surgery or any surgery that you all do. I hope you all understood this third paragraph. It is telling about how this surgery concept began, who started, and over the period of time we did not have so much advanced technologies, and we see today we have most of the facilities that we need, and so that people don't feel the pain that they used to feel during the past times. And therefore it is telling us that slowly over the period of time we have these advancements taking place in India, and therefore it is very important. In these three passages we have got a small message that always try to be out of the box. Always try something innovative that will be helpful for the future. Always you all should always have this patience in your mind. If you want to achieve something, you all need to start working so that one day you will get what you want. Okay, let's move ahead.
Before we move ahead, I just want to give you a meaning of this word, second paragraph, the fourth line. Remove it or set right that part. Set right that part means to make something accurate or to make it look like it is there in a proper way. Okay, so the meaning of set right that part means to make something accurate or fair. Okay, so the doctors, when the doctor cut down that particular part of the body that is unhealthy, they remove it out and they fix it as accurate as they can. Okay, now let's move ahead.
Over the years now, revolutionary steps have been taken in different types of complicated surgery, and these have made such operations successful. So now over the years, we see that there were this advanced changes, advanced steps taken place in different complicated surgeries, and this have made such operations successful. Let us start with cardiac surgery. Now, what is cardiac surgery? It is related to the heart surgery, any heart problems. Okay, so the meaning of cardiac surgery means heart surgery. Okay, so let us start with cardiac surgery. Today, if you need to have a heart surgery, you can choose from many fine doctors. However, before 1893, this type of surgery was unknown. Doctors did not have modern medical tools and procedures essential for heart surgery. In those days, heart patients were treated with sedatives and they unusually did not survive. Okay, so now they started with one surgery known as the cardiac surgery, which is also known as a heart surgery. And today, if you all search on your Google about the best doctors for cardiac surgery, you all will get lists of names of various doctors who have qualified in this particular subject, and you all can go anywhere for the treatment. But previously, around in 1893, people did not have that options where they can search for a good doctor, and therefore doctors did not have that modern medical tools and procedures where they can have essential means very effective heart surgery so that the people can get cured. In those days, heart patients were treated with sedatives. Sedatives means substance that makes someone sleep. It is a substance that makes someone sleep. Okay? And they unusually did not survive. So, even though if they used to give this treatment with sedatives, we see that most of the patients did not survive during those times. So then in 1893, we had a person named as Daniel Hale Williams, a young African-American surgeon, attempted a new medical technique in order to save a patient's life. So then all this I was talking earlier had happened before 1893, where there were not medical tools and procedures. But we see after 1893. After 1893, we have a well-known person named as Daniel Hale Williams, who was a young African-American surgeon who used to attempt this medical technique so that in order to save patient's life. A patient known as James Cornish was suffering from a various serious knife wound. The knife had cut an artery less than an inch from his heart and punctured the pericardium, the sac around the blood. Dr. William, with 6 staff doctors, performed a complicated and daring operation. Dr. William became the first surgeon to save his patient by successfully repairing the human heart. So one of the patient named as James Cornish, he was suffering from an various serious knife wound. So this knife had cut his artery less than an inch from his heart, and that has punctured the pericardium, that means the sac around the blood. Okay, and this Dr. William, with almost 6 of his doctor, had performed this complicated operation, and Dr. William was successful in repairing the human heart. And we see that it was Dr. William who made it possible for this James Cornish to survive with his 6 more staff so that he can live more. So we see that over the period of time, even though there were no facilities, we see that some people who are interested, who used to study, came up over the period of time and they tried to save many lives. Okay, and you all know if you all just get a small cut, how much painful it is. And just imagine if you get a wound on your chest where your heart pumps blood for you all. It can be so dangerous, and therefore even teachers tell you all that don't play with this rounder or something sharp object like pencil or pen, so that it can, if you all get hurt, it is so difficult for you all to get recovered, for anyone to get recovered. So always teacher tells you all to be careful while playing so that you all don't get hurt, because just imagine if you cut your finger with a knife, so much amount of blood comes out. Just imagine if you get hurt anywhere, that can lose so much blood. So always be very careful while playing. Okay.
Also, the meaning of pericardium means it is there are layers in our heart. So that layer was being hurted by that knife. Okay, so that is known as pericardium. Okay, where, as mentioned in the picture, to reach the particular heart there are a lot of layers. Okay, and that layers is known as pericardium. And we see that how essential this cardiac surgery has. It needs so much of observation, minute details, because it's very important that our heart pumps blood. If our heart stops pumping blood, then we might not be alive, and therefore we always need to be very careful on our each and every move that we take in our life. Okay.